My name is Stacy Smallwood. I have the pleasure of serving as the executive director of the Faith Compass Center at the Wake Forest University School of Divinity, and it is my honor to help facilitate today's conversation around the state of the South, recommendations for HIV equity and health justice. I also want to acknowledge our partners who are present here who have been instrumental in compiling the information that we're going to be discussing today and for leading the pathway forward. So I really want to take the time to thank AIDS United, Black South Rising, and you will hear from representatives from both of those organizations shortly, as well as our fellow partners in the Gilead Compass Initiative, which we'll talk about in a little bit more detail in just a moment. What we are presenting here today is a synthesis of 10 community listening sessions that we held across the South, some of them being in person, some of them being virtual. And we asked people that were closest to the epidemic three things. What is it that you've built? What is it that's breaking? And what is it that needs to change in order for us to fully address the HIV epidemic, particularly in the US South? And so the information that will be shared with you has been prepared by AIDS United on behalf of the Compass Initiative in partnership with Black South Rising. And before we go on, if you would just indicate in the chat, or if you have access to the Q&A button, if you were part of one of the listening sessions. So we want to be able to kind of have a sense or put our finger on the pulse of who's in the room, who helped to contribute to the information that's going to be shared today, as well as give you an opportunity to respond once we get to the end of the presentation. So with that, let's go to the next slide. And so just a little bit of background about the Compass Initiative. We are now 9 years into a 10-year commitment that Gilead Sciences made to help build the infrastructure for the Southern HIV response. And so during the course of these past 9 years across multiple implementing partners, including AIDS United, the Wake Forest University School of Divinity, the University of Houston, Emory University, and the Southern AIDS Coalition, there was a commitment of $100 million over 10 years, which has actually translated into an actual commitment of $133 million that have been invested across the South, including direct giving, so directly funding organizations across the South to respond to the HIV epidemic in the South. During that time, we have awarded over 1,500 grants, actually more than 1,600 grants to 498 community organizations across the South. We have engaged over 651,000 people and trained nearly 590,000. And so one of the important things to take note of in this overall commitment is that 84% of the organizations that we funded were led by the priority populations that they serve. 86% of our participants leave our programs with stronger leadership skills. And there has been a leveraging of that investment such that for every dollar that was awarded, pulled in 87 cents of additional funding, which basically translates to $116 million that our funded partners were able to leverage beyond Compass. And so when we talk about things like return on investment for those who are oriented to those terms, there has definitely been a return on investment through the Compass Initiative. And so this demonstrates a durable funding infrastructure that was built and owned by the community. And this is an infrastructure that will continue to move forward in order to help support the HIV response in the US South. So, as we go to the next slide, it's very exciting for us to talk about the successes of the Compass Initiative and the strengths that have emerged. But we also have to recognize that there is a tension that exists here. And the tension at the heart of this report is that everything the Compass has built is very real. And at the same time, it is actively under threat. And so our partners have described a funding environment that is structurally hostile to the people who are doing the most critical work, which includes reimbursement contracts that open 60 to 90-day cash gaps, 1 year grants that make sustainability of planning um, impossible in many cases. The federal rollbacks that we have noted in our current climate that have ended some projects mid-cycle. Banks refusing to lend lines of credit. And also our trans siblings, like the trans specific funding being cut first and cut deepest. And so the human cost looks like leaders who are foregoing their own pay and unable to even offer their staff health insurance. And so it is this obvious tension that makes very real and apparent why the next steps matter. And so, to continue this conversation, it is my pleasure to invite Venita Ray to come in from Black South Rising and to talk about how the barriers are not just social, they are also political. Venita?
Yeah, thank you, Stacy. And it is really a pleasure to be here today, y'all. This was really a labor of love for Black South Rising. We're really excited to be part of this process and to be able to bring our kind of expertise to this. And one of the ways that we, in working with Compass and Age United, decided to come out and have a conversation was in full alignment and awareness of the political context that we are working in. And so we decided to come out and talk about it, have a political conversation with folks. We didn't know how folks might take that because we know in the HIV community we talk about social determinants a lot, and we came out really trying to talk about the political determinants. And in every place that we went, folks understood the assignment really well across all of the four cities. Even though, like, I'm a person living with HIV, y'all too, and we always talk about social determinants. When we presented this kind of power building frameworks of what the political determinants were, people understood immediately how that was different in the ways we build power. In every city, every virtual setting, folks acknowledge we have needs in what our lived experience shows us, but we also understand that the fight is political. And folks grasp that really quickly. And so it's important because we want to know who holds power. If our people are people who understand our needs or responsive to our needs, if they're not holding power, we're not going to get our needs met. So the political aspects are who holds power, how are resources distributed, who decides what gets distributed, what policies are enacted, and which things are blocked. So we use a political determinants of health power building framework, which talks about to get our needs met, we need to be working upstream because that's where the political decisions are being made. And we understand it, but we just know that now we need to shift. So, in all of those listening sessions, and even with the introduction of a new concept for some around the political determinants of health, we did engage with pre and post tests. And most folks weren't that familiar with some of this, but we saw a 55% increase in understanding of the political determinants of health by the time that we left, folks. And then we've been hearing from folks since we were there. And folks are really excited about being able to look at this a different way and being able to really interpret what the assignment is. So I was really excited about that. And I guess I'll turn this over to Vienna now, who is I'm gonna tell y'all the kind of the brains behind some of this, who took this and made it real, took ideas and brought them to paper and brought them to realization. So Vienna, I will give them you.
Thank you, Venita. Thank you, everyone, for joining today. I'm the Senior Manager of Impact and Evaluation here at AIDS United, and this was an incredible experience because we got to the opportunity to listen. Because as Stacy mentioned and as Venita said, the political determinants of health were things that everyone knew about, but we wanted to actually hear everyone say it in their own voice. So we were able to have 10 listening sessions, and in total, we reached over 227 people across 10 southern states. And in total, we had about 89 organizations that were part of this experience. So we had four in-person sessions that were led by Black South Rising, Vanita and Max here today. These states were, we had Houston, Texas, Columbia, South Carolina, Atlanta, Georgia, and Orlando, Florida. And if you were part of that, don't forget to say it in the chat, in the comments. Yes, so we were part of that, and they led these sessions incredibly. I wish if you were not there, I hope one day you get to be part of it because it's incredible to see how they work together. And then we also had six virtual sessions, and these were led by AIDS United. And we wanted to make sure we reach people who are not able to come to the in person, and also just communities that may need to have special conversations within themselves about topics that maybe in other scenarios or in other settings may be overlooked. So this included Black gay men in Arkansas, trans mass communities in Atlanta, community health organizations, and trans women and youth in Atlanta again, and then also Latinx communities in the South, advocates in South Carolina, rural people living with HIV, people with disabilities and recovering communities. So we made sure that it was really well encompassing. So as Benita said, we also did pre and post surveys. And, as she mentioned, we had, a huge uptake of people learning about the political determinants of health and understanding what they've known actually has a name. What they've been experiencing has a title and it's well researched, and they kind of can get affirmed in that concept. Oh yeah. So, and then we also wanted to determine what are the cross-cutting themes, like what are the things that everyone said across all 10 sessions. And it was really reflective and really illuminating. And we're going to talk about it a little bit further. But first, I'm going to talk about the next slide is going to discuss a visioning exercise that Vanita wanted to have before anyone showed up for these.
So you all know that, everything we do, we may have, and I don't believe in scarcity, but we were dealing with limited resources, so only four cities, and thus we created the virtual spaces to allow people to expand the conversation. And another way that we dealt with the limited time was that we asked folks who we had specifically curated to be in the room to do some pre-work. And one of the ways we did that was a Mentimeter, and we wanted to get folks' voices in the room before we even got there. So we asked folks with the pre-materials that we sent them out on political determinants, but a Mentimeter, what is the community you want to see? What's the vision for the South, and what stands in the way of that vision? And if you look at the slide on and so when we did this for each of the in-person sessions, so this slide kind of we saw such a similarity. This slide really kind of encompasses what we heard in four places. People, the vision that they had was very similar. Safe, inclusive, healing, thriving, all of those things that the Southerners know about. And then on the right, it was interesting. What are the barriers? This happened before we even got in the room, where we thought we might have saw, case management or linkage to care or something. Folks really were already ready for us to talk about the political and the systemic issues, and identifying, as you know, where the larger words are. Those were the words that were repeated over and over: white supremacy, systemic racism, anti-blackness, poverty. Folks understand this. If nobody said poor health literacy, lack of motivation, we don't know how to take care of ourselves, which we often hear in the broader, communication or narrative sphere. So this really, we think folks came into the room ready. When they saw this, when they came in the room, that folks had a chance to add to it or comment on how they felt. And it was not, I don't think, a coincidence that everyone in the South was pretty similar in their vision and what they saw as the barriers. And so we were able to have a really great conversation around political determinants, so that we could elevate the conversation from just those immediate needs that are identified by the social determinants of health, with the broader needs of how do we get our needs met so that we can improve our social determinants of health. And next slide. And so some of it, each time afterwards, we took a lot of notes. We had note takers, facilitators. We did focus group. We did some creative engagement. But six cross-cutting themes were elevated throughout all four in-person sessions and even the virtual ones. Hold on, my notes are not as good. So we people were entirely ready for the pivot from social determinants to political determinants as a power building framework to get our needs met. People were definitely ready to see safety and criminalization as a health policy, not just as a social determinant condition that we need. That is, if we're safe, then we're healthier. If we're not being criminalized, we're healthier and have greater access. People also identified basic needs as HIV infrastructure, and we this was really important and really happy to see this because sometimes we see HIV funders say, "Hey," or people saying we're not funding HIV, we're funding these needs. And what folks were saying is all those needs are still the same needs we had in addition to our HIV. So basic needs are HIV infrastructure. People also talked about erasure, narrative, truth, and memory, making sure that our stories are captured. One of the activities, power building activities, is narrative building, controlling our narrative, storytelling, and folks really understood that truth and memory, as we see they're banning books trying to change history, that folks wanted to document where we've been and where we're going. Folks also understand, and Max talks about this a lot, about intersectional solidarity. The solidarity must be operational. In this political climate, we don't have the luxury of waiting on others to come save us. We must begin to organize as a practice ourselves and prepare ourselves for what's coming. So it needs to be operational. We can't wait. We can't wait to get ready to get our needs met. And then the last thing, which I'm so excited about, is power through governance. Folks understood that when we are in the position of making decisions, then we that affect our lives, we build power through representation, power through governance, whether you're serving on a planning body, any of the most cities have all kind of commissions, local school boards, all of that, your county, your state, that power through governance, and those governance activities that are accessible to you, you definitely have power through that, and supporting our own candidates for these kinds of things. So this was the communities analysis, and I am just really excited that they went where the need is, and folks often underestimate the sophistication of our folks. So I'll stop here and turn it over to Max. And Max,
Thank
please
you.
comment on anything I just said because I might have missed something.
Oh no, you did a great job, Venita, and thank you for breaking down those six pieces created and really nurtured through community, through the multiple in-person gatherings, plus the virtual gatherings, and even hybrid gatherings that we did in both Arkansas and in Jackson, Mississippi. One of the things that we want to continue to be able to also be able to do is think about what is the next phase, what are the next steps, and these are the important things that we have to think about. And one of the things that we want to continue to think about is making sure that the coalition continue like the spine of it. We have to make sure that we continue these coalitions and continue these spaces of growing and building together. And also making sure that we have the durable infrastructure to keep these coalitions going on, especially in a time where our communities are under attack in ways that have not been to this great vast in many years. So it is important for us to keep the infrastructure of the coalitions that have been built over the last 9 years and even previous still intact, while also creating new coalitions and new spaces to be able to address the new attacks that are also going on, and being able to reform and rethink about some of the ways in which we build coalition. We also offer some trainings around the offering and thinking about of expanding and also changing coalitions as well. And then the second part of this is also making sure that data justice and narrative labs are, and the reason that these two are important is community-led data is very important as we see not only this administration, but other spaces taking away or trying to take away data that our folks have worked very hard to make happen. And we have to make sure that community-led data and science projects are continually supported during this time. And then also coupling that with storytelling. And what has been continuous a piece was the power of storytelling is important for us, not just in our advocacy, but also in our ability to make change happen in our communities and to make sure that our communities are understanding how in which people are impacted. The third piece, and was also connected to this, is we have to continue to work on governance. And that means meaningful involvement of people living with HIV, but that also means meaningful involvement of locally elected officials, from mayors to state legislators, to townships, and then even folks that work on like labor commissioners, work on health boards. All of these have to be engaged in our order to make sure that we're able to address our community's needs. And then we have to, as was talked about in this local governance pieces, in order for us to make sure that people's basic needs are met. We have to make sure that we create safe spaces for our communities, be it the clinics that people are engaging with, be it the larger community spaces that we're engaging folks with, and especially when we see attacks like on people because of their immigration status, because of their HIV status, between or even because of their work status. We need to make sure that the spaces that we're creating within our community continues to be safe spaces, that no matter what a folks' status is, that they're able to engage in these spaces in a safe way. And we have to also engage in those principles to make sure that our community that are most vulnerable and most attacked right now have spaces continue to get engaged. And then we have to continue to organize trusted messengers within our communities, no matter where they're based. And that means if it going to folks on the border, to engaging folks in trap houses or other spaces that folks were actively talking about throughout their time in every city that we had a chance to gather information and learn more about how in which the Compass Initiative had impacted their communities. We understood that people were going to the places that our community is at. And as we continue to do that, we have to make sure that we are training folks up to be trusted messengers, to continue to get the right information, make sure that they're getting the updated science, but also being able to learn creative ways to be able to get their messages out. I was able to be on a PWN training just yesterday that they are part of their PWN Vote series, talking about ways in which they continue to train up their messengers. And then lastly is we have to have sustainable leaders throughout this time. And we have to sustain the leadership. And that means supporting with resources, but that also means we're supporting with trainings, with different cohorts for learning initiatives, but making sure that folks are in community with each other in order to continue to build and learn from each other as we continue to get to the next level of what is necessary for us to be able to not just end the HIV epidemic, but make sure that people living with HIV are living long, healthy lives, and our communities overall are being in a more liberated, equitable space. Next slide.
Yeah, keep going, Max. You got it.
And see, as we were talking about this, and we talked about sustainability, being able to have this go on for multiple years, we have to also talk about what the mandate is for funders. And we understood this was a project even before the Compass Initiative, the Southern HIV Impact Fund, that was impact of multiple funders impacting the HIV with special focus in the Southern United States. And we understand that we have certain things that we learned from that were clearly that our communities still need from funders right now, but also there's even more of an ask with the continued attacks that our communities are going through. And the first one of those is for continued long-term funding. We talked about at least a minimum of 3 years, but multiple year flexible funding that allows for, as we're seeing new attacks that communities are going through, as we're seeing new old resources that many folks had depended on being continuously slashed and cut away, that we need multi-year funding and different flexible source ways to be able to use this so organizations can plan for the future and be able to continue to deal with the attacks that are going on. And that the basic needs are made within this for HIV funding, and that includes housing, food, and transportation. Especially when we think about different ways in the South where we're seeing different community-based organizations having funding continuously cut. We have to think about ways in which we're able to make up for some of that funding as folks and these direct support programs are being cut because they still folks need their basic needs met to be able to continue to make sure that they're able to live long, healthy lives, but also continue to fight for what our communities truly need on as we talk through the political determinants of health. And then advocacy is a health investment, and we understand like if we're actually continuing getting our folks not just to get to their basic needs, but to be able to be better advocates, not just those people that are working at your clinic or just getting clinical services, but also the people connected to them, their family, their friends, other community members, their church members, and other pieces. Getting them involved is an important ability for us to be able to have a more informed society, a better community, and communities that can make sure that we're actually getting people to the health that needs that they have, and that we understand that that investment and gets all of our communities to a better space. And I will pass it back to Venita.
Yeah, and thank you, Max. And can you go back to that slide? I want to say advocacy, which means individual leadership development. Investing in people is critical. I can tell you, Age United did a pop grant for us $40,000 years ago, and it's still reaping benefits because people were developed who are now running organizations and leadership. So advocacy, if your Medicare was cut, I guarantee you're probably not voting. If you're not getting care, you're probably not voting either. So the intersection of health and democracy are really important. So investing in people and then back those closest to the problem. We talk about this all the time. We say it in MIPA, which is MIPA might have been invented for the HIV community in 1983, but the idea that it's trying to show about centering those most impacted and those closer to the problem is a universal concept we've used in engagement for years. You if you're designing something, if you're not including the people you call yourself serving, that is not what we want. So people closest to the problem are closest to the solution, and they are also the people we want out there sharing the solution. Last thing I'll say on this mandate for funders, another piece we had in this process that we did was our final topic was commitment and action. So we also looked around at each other. And you have access to a funder, I may not have access. You have access to something, data that I may not. So the commitment and action we are willing as individuals to bring to this, as well as maintaining relationships with our funders, and that we all have access that we can share that will help us maintain the kind of services and care we want for our community. So back those closest to it, and funders, we need y'all to really understand communities are different from some regular organizations, and we need programs and funding designed for those communities. That's all. Thank you. You can go to the next slide.
All right. Thank you so much, Max and Venita.
Oh, yeah.
And as we prepare to bring our part of the conversation to a close, but then also open it up for your feedback, your questions, your input. Um, what you have heard throughout this presentation is the importance of us being able to tell our own stories in our own words. Narrative is critical to all of the work that we're doing. And so we want to start closing this piece out with the narrative from one of the participants in the Orlando listening session. And this participant said, "My vision is still very much alive. If anything, the social and political climate has clarified it and reinforced its urgency." What this quote says or communicates is that even in this time where it feels as though there are so many obstacles that are being mounted in our way, that there are all kinds of reasons why we could be discouraged, there's still a vision that propels us forward. A quote that comes to mind when I think about this is it says, "When nothing is certain, everything is possible. we still have a vision. We
Mhm.
still have the ability to enact that vision. And this was the spirit that was represented in every room in which we had a listening session, whether it was in person or virtual, across the entire South. The community is ready. The real question that stands before us right now is whether the systems that are around the community will match the urgency of the moment. And also, we want to thank the organizations that help to make these virtual listening sessions possible. It is their trust and their investment in these critical conversations that made this whole project possible. And so you see them represented here. But again, we are galvanized, we are ready, we have the vision, and it is time for us to really just drive it forward and not be discouraged by the terms and conditions that surround us. And so, as we prepare to close and go into our discussion, I'd like to turn it back over to Max to kind of give a summary of what we have discussed today, and then we'll move into conversation.
Yes. So, and thank you so very much for that, Stacy, and that overview. What we started was with talking about the legacy and impact of the Compass Initiative over the last 9+1 years. The over 133 million investment in this Southern equity, and then how in which we centered the most impacted as we were doing that, and that this was a massive community mobilization. Opportunity that many of our folks were able to use to create organizations, make organizations larger, build community in deeper spaces that are some of the most impacted spaces. And we understand one of the biggest problems for us to be able to get to that space is the political determinants of health. And understanding that these hostile political determinants have made it more difficult for us to even create growth. But in many ways, it has created diamonds in different space throughout that pressure, and having spaces for our communities to continue to grow in. And then having the solutions that we have come through, which were one, being able to hear the six like clear problems that folks were addressing, while also being able to think about that we need a stronger Southern coalitions. We need data justice and narrative labs across the South to be able to push back, and to be able to have even greater advocacy and greater spaces for us. And then having local power and engaging governance from the smallest local level all the way to the federal level is important for our people to continue to build power. And then making sure that our folks' basic needs are met through different mutual aid services, and making sure that we do that within our programs, within our community, and within our organizations will also lead to us making sure that we have our trusted messengers organized throughout our communities, and then having a sustainable leadership, and making sure that our funders are hearing that those asks, as we continue to engage them, and have a reinvestment in the South, and making sure that the South has something to say, and we will continue to be uplifting these messages from all of our communities as we engage not just funders but also more community members and build the tables that we want folks to be able to have. Um, and if folks are interested in partnering more with Black South Rising as we continue to build these tables in these spaces, feel free to join us with and just fill out the form that I just put in the chat. Thank y'all.
Right. Thank you,
And now we're
Max.
going to open it to a discussion. Yeah.
Yes, this is where we are so happy to invite all of you into the conversation. We shared a lot of information with you. And again, some of you were instrumental in helping to contribute to what we have been able to share. Yes, Venita has indicated that some of you that we see here in the room were part of these listening sessions and these discussions and conversations that we had. And also, some of you for as I noted in the chat, this is your first time coming to know what this State of the South listening tour looked like. So we want to invite you to share your perspectives. And just to get us started, does the information that we shared today align with your experience? Are there things that we discussed that really resonate with you? And are there things that maybe should also be included as we are this, because this is a living organism of a project, right? It is not fixed. And so, are there other things that we should consider? So, we want to hear from you. Feel free to share in the chat. Did we get it right? What stands out to you as something that you want to highlight? And also, as a call to action, what is it from this that you feel as though you can take and use in your respective communities that will help to advance our collective impact, our collective efforts? So, again, feel free to share in the chat. I believe that people have the ability to raise your hand if you would like to speak as well. But we really are interested in what your reactions and your reflections are, and also your action steps in how to move forward. Ariel, I see your hand.
Hi, Stacy. Hi, everyone. Thank you so much for this presentation, for this amazing work. I'm really excited about this data justice and sort of like narrative justice theme that came up. Um, yeah, I think, some of these systems that we're used to relying on, CDC, et cetera, are totally collapsing. So taking the data collection into our own hands is makes sense as the next step. And it's very cool that that's coming up among community as sort of a source of like people power. Um, One question that I'm having is like, how do we think about safely, archiving and hosting the data that we're collecting? And actually, this everything that you just presented is a great example of something that should be saved, should be shared, can help inform both care and advocacy. So I'm wondering if any sort of solutions ideas came up around, is it that we partner with universities? Like Emory is a great example, right? Like, is that the place where it's hosted? Is the hosting itself sort of community owned and community led? So yeah, very excited about that and just curious about more thoughts on that in general.
Yeah, I have some quick thoughts, and I'll let some of the, those connected to universities maybe also have more to say. But I do think when using that in trusted spaces and trusted universities that we can be able to have that. I also think there's community-based organizations that have like rich amounts of history that don't get actually told in many spaces and don't get actually archived in a proper way. And I think there should be spaces for that. And then also like research libraries and also just like there's we got some local historians also within our community, and I know this has also been done in some of the criminal justice reform folks, and some of the abolition workers, having different folks that are working in different libraries, have a track record in the background of doing this. It doesn't have to be necessarily baked into the university, but using those folks that have those backgrounds, and also resourcing them to be able to have proper access to those histories as much as possible. And I think there's also a lot that we could learn from our global partners as well, that have found some creative ways to make sure that the history is kept without being necessarily put into the wrong governmental hands. And always thank you for the thoughtful question, Ariel.
I just want to add, Ariel, you came up with ideas. We didn't get to the idea of next stage, but we are happy and would love to begin having some of those conversations, because I think everything you named is on the plate. I also think there could be community organizations that could take on a role, who have capacity. I'm thinking of game changing men who have been doing evaluation for the longest, who we had this data conversation with who could see their role as that, so that we could always have access, and we'd have to think of how to, manage access, manage integrity of the data. So our people would have to learn how to do that. So anyway, I love that. I'll stop because I see some other people that I know was in the room, like Denise, like Sandy, Daniel, that was in some of them rooms. I'd love to hear anything from y'all about what you thought, how it didn't hit the mark. What have you done since? Did we capture what you said? Could you look at our notes and say, I was in the room, we did say that.
And Venita, just to build on what you just said, and as people are preparing to provide their input, I do want to speak to something from from the perspective of how to engage with institutions like universities around this. Um, Being someone who is in a university setting, um, universities have immense resources, thought partnership capability, all kinds of things. The ask has to be very clear so that the data, the information, because data is power. So it's important that that power dynamic be negotiated from the very beginning if you're working with a university so that the information does not get subsumed by the institution. I'll stop there because I see other hands. I want to recognize Leisha, and then also after Leisha, then Daniel.
So good afternoon, everyone. I want to, Benita, speak to your question. Did you all get it right? And I'm certain you know the answer to this. Absolutely, yes, you did. And that in itself is important because it speaks to the facilitators, the framing of what the people had to say. You've captured it in a way to run with that for us. So that's one thing. The second thing is I'm challenging us, and Ariel made me think about this. This wasn't part of my comments, but my colleague there made me think about, we have these opportunities where we are coming together, and I call them these family reunion meetings. We just normally just don't bring the potato salad and the mac and cheese to the event. But SOS, what next weekend? We've got the USCHA. We have to maximize those moments of being together. What is our messaging even before we get there? How are we taking a tool like this and then elevating it to those who might not have had the opportunity to be in the room? And how are we also ensuring that coalitions and leaders like Black South Rising, who a lot of folks may not have known who you were prior to this tour, taking that and using that to our advantage, and that's a task that all of us who are present can take on by being our own internal champions of community voices.
Thank you, Leisha. And um, and Daniel, I'm coming to you next. Okay, we got two Daniels in the queue, but I just want, Leisha, thank you for that. And also speaking to the importance of something that I saw in the chat. These are your data. Use it, use them. Write these, you cite these sources in your grant opportunity, in your grant applications, in your appeals to local government. Like these are your data. So please take full advantage of this work that has been done. Daniel Downer, and then Denise, and then my dear Reverend Dr. Sandy.
Hi, Daniel Downer, he, him. So glad to share space and time. And I echo Auntie Alicia's sentiments about I was in the Orlando session with Venita and Max and also Stacy, and really appreciate there were so many things that were glows. I think one of the things that I remember very vaguely that stood out, and I believe my comrade before me had talked about the data point, and I was like, yes, yes, the data aspect. I was like, yes, like I think sometimes community and even all of us in this ecosystem fail to realize that like storytelling is archiving. It doesn't have like on whatever level it is, right? Whether that's academic or on the community level. I appreciate in the Orlando session how we were really talking about communication in the sense of recognizing, and it kind of connected to the session with Venita. Like, there's a privilege that comes with being able to access technology online and social media. And while that's great for us to get that message out, I think of respectively in places that I've lived, being a Florida boy and now in Southern Appalachia, there are people who are not, who don't have the privilege of technology. And so, like thinking about Black queer men who live, and Auntie Leisha knows this area well, the muck of Florida around Lake Okeechobee, Belglade, Clewiston, Winter Haven, folks who live up in Southern Appalachia, outside of, like Asheville who are not who can't get this information, right? Or who can't come to these gatherings like USCHA. How are we engaging them? How are we getting the information to them? But also like how are we centering like their unique lived experiences when we're talking about HIV, because I can tell you it's completely different how community here up in Southern Appalachia talks about HIV, how we access these services, how we let people in, and how we build trust and community. And so I really appreciated in the Orlando session us kind of looking at how we really have to make this realistic and unique. It's not a one strategy, one action item fits all for everyone.
Thank you, Daniel. Does anyone want to um, respond to that? Max,
I want to get to
Venita?
the comments.
Hmm?
I think we should, if we can get to more comments and then we can move
Okay,
on.
so let's go ahead and get additional comments in. Um, Reverend Dr. Sandy.
Okay. Thank y'all so much. Can you hear me? Perfect. So I'm gonna be honest. I really did not know how important research and data was. Been a preacher, we didn't need all that. But coming into this particular world for the past 9, going on 10 years, that is crucial for your next step of pivot. And the way that room loved on us for people who were not as educated with the terminology, I have to give Max, Benita, I have to give y'all props because you made it so educated for me, as if I was a person, and I'm not saying this crazy, as if I was a third grader trying to understand. And I don't belittle myself. I give you props because you made sure that everybody in that room could understand the language. Everybody in that room could understand the importance of their voice. And everybody in that room has a voice, whether it's faith, whether it's people in recovery, everybody's story mattered, and the data matters for us to be better at what we do. So, did you get it wrong? No, ma'am. No, sir. You got it right. And I appreciate what everything that y'all do and going forward, because we're going to need you to make sure that we kill what the enemy is trying to kill with us. That's it.
Thank you so much. Thank you. Denise, I see your hand.
Good afternoon, everyone. Um, y'all did get it, y'all got it exactly right. And the best part of it all is the fact that people are becoming more conscientious about data and how to use data. For many years, that was my go-to to in this work here. And now with the political determinants of health here in South Carolina, me and my cohorts, we got together and we putting in for a 5-year grant. And what the 5-year grant is going to do is going to allow us to be able to collect data from a different source. The Positive Coalition Project is in the process of forming a care access specialist team to be a referral service for non-clinical services in order to address the political determinants of health. That will also give us the ability to access raw data and show to our our legislators and the powers there be what they're missing in the process. And by us all, collaborating together, trans action, transforce action and action. So I'm sorry, y'all.
Force and
We are
action.
working. Thank you, T. Come on and speak. So we're doing on boots on the ground. We'll have CHWs working in different zip codes to kind of to gather all this information. I'm just so glad that y'all did come to South Carolina and shake up everything, because we really needed a waking and a shaking. So I'm really excited. Y'all did a great job. We want to stay in the loop, and y'all need to keep doing what y'all doing, because it's finally getting out there now. People are becoming, like I said, people are becoming more aware. But speaking for South Carolina, yes, we have our boots on the ground.
And let me just say, before I get to the other comments, as someone who lived in Columbia, South Carolina for 13 years and got started in this work in Columbia, look, I'm right there with you. Clacking fans and all. Um, I want to also bring in a couple of things from the chat into the conversation. Gabrielle mentioned provided something for us to think about in terms of smaller organizations being able to have continued dialogue in dissecting these MOUs and the legal jargon. And I think this is another power dynamic issue that needs to be part of the conversation in terms of how organizations are engaging with larger institutions and having informed conversations with the institutions that typically hold power but don't have to exert their power in the same way. So I want to bring that into the conversation. And then I also see a comment from Wanda around resources like this webinar being accessible. We are going to make this accessible. We are recording this. We have the report that is available. So please, this is part of exercising power. This is part of how we are democratizing this process. So even though there may not necessarily be folks who are on this call right now, please take this, share this with them, because that is what this is all about. It's the information sharing. I also want to then just lift up another comment from Linda around being intentional to memorialize and document this era. Yes, because this is our story. Like, sorry, the preacher in me wants to say, this is my story. This is my song. This is our story. This is our song. So please, by all means, take everything that you're getting from this and share it throughout your networks and broadcast it. Use every megaphone, every microphone, every bullhorn, every platform that you can to share this. Daniel, I see your hand. Oh, Venita, did you want to chime in?
Yeah, so I want y'all to share it, but let's host some conversations, because folks get shared stuff every day, right? And sharing is important, so we get it out there. But if you want to have some individual conversations about any aspect of this, reach back out to Age United, to BSR, because sometimes you got to walk through this with people so we can sit down, just like we did with South Carolina and others. So ask for help, because people gonna need help. Just sharing it is one thing, get it out there, but let's host some conversations, and BSR will be happy to attend. Thank you. That's all I wanted to say.
And just to add off of that, is if you're looking to interest and partner with us more, fill out the form. I will be at SOS and I will be at USCHA if you want to sit down and talk more. If you want to talk more, as Alicia said, and had them conversations before the conversations. If you want to talk more about how we can like also build together in these spaces, or if you wanted us to come and do it in a more local space, connect to you in your community. I know we've had folks in South Carolina and Arkansas reach out. We would love to do that more. That's what I love to do. And shout out to those that are doing tours like Leisha and Daniel doing it in Georgia right now, what they did, Leisha did in Florida earlier this year. These tours are important engagement tools as we continue to organize for the future.
Thank you, Max. Thank you, Venita. I want to lift up what Leisha just said in the chat, and then Daniel. I know that the hour's drawing near, but Leisha makes such a critical point in the chat to stop giving up our power to entities that want to speak for us instead of giving us the platform to speak for ourselves. The world needs to know who we are. So thank you for lifting that up, Leisha. Daniel.
Yeah, I thought about one more thing that I felt was like so important from the Orlando session with Venita and Max. And I know it's not unique to the Orlando area, but we had such a rich conversation around um, partnerships with the legal community and organizations, specifically as we think about currently in this climate with ICE. I think a lot of folks don't recognize that like ICE isn't only like picking up like our Latin siblings. They're picking up anyone who they suspect or feel is not white. Let's just call it what it is. And that's a whole process. And like ICE has shown up at HIV service organizations and pulled staff and pulled clients, and clients are afraid to go to organizations. And so what I appreciated about like the Orlando conversation, that conversation we had in Orlando was like, how are we equipping staff at these organizations? Like, is there a contingency plan if ICE shows up when we are doing these convenings, whether it's USCHA? Like, are we recognizing, like, how are we keeping our people safe? Because anything that's a public advertised gathering, they can show up, right? And so I really appreciated how in Orlando we kind of talked about like some organizations, the plans that they have in place, the safety plans they have in place, how they're trying to, you know, maybe not necessarily publicize specific gatherings to keep people safe. So just wanted to uplift that too.
Thank you, Daniel. And I dropped in links for Advancement Project and Southern Poverty Law Center as good partners to look into around that space. And of course, our friends at CHLP, with Mandisa, big shout out to them.
Absolutely. Our great comrade Mandisa Moore O'Neill at CHLP. All right, we are at the end of the hour. I want to be respectful of your time. Thank you all so much for being here, for lending your presence, your voice, your perspective to this conversation. And again, this is a living document. These conversations don't end just because the State of the South tour ended. We are continuing this dialogue. So please feel free to reach out to any of us to lend your perspective, anything that you think we got really on the mark, and anything that may need to be included going forward. So we appreciate you so much. For those of you who are going to USCHA, we will see you in Anaheim next month. I can't believe it's next month, but on behalf of the Compass Initiative, AIDS United, Black South Rising, we're just so appreciative of you being here today and look forward to being in continued dialogue with you as we move forward.
Thank you, everyone.